So to qualify for these subsidies, the Obamacare subsidies, you must meet the following criteria. You're living in the United States, you're a U.S. citizen or a legal resident, you're not currently incarcerated, and your income is no more than 400% of the federal poverty level. But however, for this year, it's no more than 500% for 2022.
Are you ready for a successful retirement? We're addressing the topics facing today's retirees. Welcome to Retire with Ryan. Now here's your host, Ryan Morrissey.
Welcome back. This is episode 93. And retirees often wonder how they will afford health insurance if they retire before age 65. And the Affordable Care Act, known as ACA or Obamacare, provides subsidies to qualifying individuals and families to help make these costs more affordable. And this could be a way for you to have health insurance coverage at a reasonable cost until you reach age 65, and then you could switch over to Medicare. And in this episode, I'm going to cover 5 things that you need to know about these healthcare subsidies and how to become eligible for one. So, first of all, what are ACA tax credit subsidies? ACA subsidies are tax credits available to many people whose net income is between 100% and 400% of the federal poverty level. And that is as measured by your modified adjusted gross income. And these subsidies go toward paying the health insurance premium to offset the cost that you would otherwise pay. And this could be a way that you could significantly reduce the cost of your healthcare premium. And in some cases, it could actually even be free. And in 2020, it was estimated that 87% of the roughly 11 million people who purchased health insurance on these marketplaces received a premium subsidy. The second thing that you should know is what is the eligibility for one of these subsidies. And these subsidies are also sometimes known as tax credits, and they work on a sliding scale. And they limit the amount that you pay in monthly premiums towards your health insurance based on your modified adjusted gross income. And most people are eligible for these subsidies if they earn between 100% and 400% of the federal poverty level. And I'll get to that in a little bit. And that is also based on the size of your household as well. However, but be aware that as a result of the American Rescue Plan Act, the ARPA, signed into law on March 11th, 2021, this added further relief or eligibility for many people that were struggling to find affordable health insurance as caused by the COVID-19 pandemic. So for the past 2-year period for 2021 and into this year of 2022, many retirees can take advantage of several provisions of the ARPA that make health insurance coverage even more affordable. For example, no citizen or legally present non-citizen who doesn't have access to other affordable insurance, as an example from an employer, Medicare, or Medicaid, will pay more than 8.5% of income for a marketplace silver plan. These plans that you're eligible for have 3 different metal grades, from bronze, silver, and gold, and you'd be eligible for one of these silver plans, not more than 8.5% of your income. And most people who receive at least 1 week of unemployment compensation for any time in 2021 were eligible to also obtain a silver plan with 0 premiums and cost-sharing reductions. I'm not sure if that continues for 2022. And then individuals who earn 500% of the federal poverty level and don't have access to other affordable health insurance may take advantage of cost-sharing reductions through the marketplace plans that could be available for lower premiums. And if your income is below 138% of federal poverty level and your state has expanded its Medicaid coverage, you may qualify for Medicaid based on your income. And if your income falls below the federal poverty level, you may not qualify for subsidies, but most likely you qualify for Medicaid. And obviously, when a lot of people think of Medicaid, Medicaid is generally designed for people that don't have any assets, but it's possible that you could qualify for Medicaid just based on what has happened for the last few years. So to qualify for these subsidies, the Obamacare subsidies, you must meet the following criteria. You're living in the United States, you're a U.S. citizen or a legal resident, you're not currently incarcerated, and your income is no more than 400% of the federal poverty level. But however, for this year, it's no more than 500% for 2022. So every year, the federal government comes out with their determination of what the federal poverty level is. And in 2021, that number was $12,760 for a single individual. If you're a household size of 2, that number would go up to $17,420. A family of 3, $21,960. A family of 4, $26,500. So it keeps going up, based on your family size. So if you take, let's say, a family of 2, a married couple who's about to retire, 400% of that number would be $69,680. So that would mean that you would need to be below that level to qualify, or your modified adjusted gross income would need to be below that level to qualify for a subsidy. So that can be very powerful if you're able to keep your income below that level to qualify for the subsidy. It could significantly offset the cost of health insurance in pre-retirement or even in retirement. And again, these numbers update annually. There have been numbers released for 2022, but I just wanted to focus on the 2021 numbers because it wasn't clear whether or not those numbers were being used for 2022 or they were using the 2021 numbers to determine that. So normally you sign up for the Affordable Care Health Insurance during the open enrollment, which begins November 1st and runs until January 15th. If you wanted your coverage to start January 1, you'd obviously need to enroll before January 15th. So that's the open enrollment period. If you don't enroll during the open enrollment period, then you have to have a qualifying event that would allow you to then have a special enrollment period. So you want to be aware of this as you're trying to make sure you don't have any lapse in coverage. So you may qualify for a special enrollment period if you or anyone in your household in the 60 days has the following happen to them. You got married, you had a baby, adopted a child, placed a child for foster care, got divorced or legally separated and lost health insurance, if your spouse died, if you have a change in your residence, if you move to another state, move to another zip code, you are a student moving to another place to attend school, you're a seasonal worker, and you move from place to place to live or work, if you lose your health insurance. So any of these reasons then trigger the special enrollment period, which for the most part, you have 60 days to then enroll in a plan through one of the healthcare exchanges. Let's just say that the reason that you qualify for, like a lot of my listeners, you're planning your retirement and you're going to retire at 62. Well, you have 60 days prior to that retirement to enroll in a plan that if you're eligible through one of the affordable care exchanges so that you qualify for the subsidy. And that way, if you enroll before you lose your other coverage, you wouldn't have a lapse in coverage. You probably don't want to have a lapse in coverage because that way you're going to always have health insurance. So if you do have a catastrophic health event, an accident, it doesn't rack up large medical bills that you're not going to have to pay for, where you could have easily had coverage through the Affordable Care Plan and you wouldn't have to be paying these bills. One of the best times to probably retire is also towards the end of the year and maybe making your retirement effective January 1. That way you had health insurance coverage for the prior year. You start off fresh with a new plan where most of these plans through the Affordable Care Exchange are high deductible plans so that you didn't meet part of a deductible on your plan through work, and then you switch over to another plan. So the third thing to know is how the subsidies work. And there's two kinds of subsidies. And the more common is what's known as advanced premium credits, which can help pay for the Affordable Care health insurance premiums purchased on the marketplace through the year. And if you qualify based on your projected income for the current year, you can either take the tax credit throughout the year to be paid directly to your health insurer to offset the premium that you pay. So you would just pay the difference, or you could pay the full premium each month and then you receive your tax credit when you file your income tax return. I think most people usually like option one. And if you take the advanced tax credit, option one, and you underestimate your actual household income, you will still owe some of the advanced money you receive back at the end of the year. So make sure that you don't misestimate your income. On the other hand, if you overestimate your income, you'll receive an adjusted tax credit refund when you file your tax return. So to avoid these issues, make sure you report any changes in your income to wherever you're getting your health insurance, to that marketplace, so that they can adjust what you're paying in premiums. It's also important to know that these tax credit subsidies only apply if you buy plans through a marketplace, through either your state's marketplace, or if your state doesn't have a marketplace, through the national marketplace. Other plans that are out there, not through the marketplace, do not qualify for subsidies. So make sure that you understand that, when you're buying the plan, make sure that's a plan that qualifies for a subsidy. And the second kind of ACA subsidy is called the Cost Sharing Reduction Subsidy, a CSR. And if you're eligible, these can reduce your out-of-pocket costs for covered services by paying a portion of your deductible, co-payment, or co-insurance. So the fourth thing to know is, what information do you need to have to get started? And the most important thing to know is what your projected estimated income is for the year. And that, again, I mentioned that before, that's your modified adjusted gross income. So you'll need to know this when you apply so that you can then get an estimate of what the cost will be for your health insurance. And you need to then understand in retirement how much your Social Security would be, if you're eligible for any pensions, how much they would be, if you're going to be working at all in retirement, how much do you estimate that income to be? And then also if you're eligible for, or if you're going to take any distributions from your retirement plans, most likely that's all taxable unless they're Roth IRA or Roth 401k distributions. So you need to have a good handle on that information so that you're not going to over or underestimate that. Because as I mentioned before, if you underestimate that and you take out money from your retirement accounts that you maybe weren't planning to take out, that counts as income. You could maybe lose a lot of your subsidy, end up having to pay a lot of money back. Or if you underestimate that income, you might have been able to pay a lot less for health insurance. So it's a good idea to try to have a budget when you do retire and keep your income the same. So that way you're not going to have any surprises one way or the other with your subsidies. And if you are trying to qualify for a subsidy, keep in mind that 2022 is an odd year because of this change that was made in 2021 with the American Rescue Plan Act. Normally what would happen is that based off your family size, let's just say I mentioned earlier a family size of 2, that limit for your modified adjusted gross income would have been $69,680. So that if you estimate that's what you're going to earn, but you earn $1 over that limit, you completely lose your subsidy. This year, as was the case in last year, there's a sliding scale. So you're able to earn above that and beyond and still qualify for some type of subsidy. It might not be the whole subsidy, but it's still something. You have to keep an eye on whether or not another bill comes out of Congress and that maybe further extends the current calculation for subsidies that applied to last year and this year. Because if it doesn't and we go back to the old way of things, you want to keep a very close eye on your income and your family household size and make sure that you know exactly what that number is that you can earn up to and you don't go $1 over it so that you don't lose your subsidy. Because if you did go over that, when you file your taxes at the end of the year, that would be known and now you'd have to pay back that subsidy and you don't want to have that happen. So the fifth thing to know is, how do you apply for these subsidies? Well, as I mentioned before, you have to purchase your health insurance plan through one of the government-run healthcare exchanges. And depending on your state may have its own healthcare exchange, or they may just go through the national healthcare exchange. So my home state of Connecticut has their own healthcare exchange or healthcare marketplace. The website address is accesshealthct.com. And if you are a Connecticut resident, I would definitely, in your planning to retire before 65, you're wondering if you'd qualify for a subsidy, I would go to that website and you can go right on there. You can click on compare plans and you can put in your household size and your estimated income, and you can play around with the numbers to get an idea of what the subsidy might be that you'd be eligible for. But keep in mind, if you're retiring in 2023, you'd need to check back and see if the current subsidy structure that they have, they extend into next year. Because if they don't, then you need to keep a really close eye on what the federal poverty limit is for your household. If you're in a state that doesn't have their own exchange, you can go to healthcare.gov. And from there, you can also do the same thing. You can play around with the income numbers and see what type of subsidy that you would qualify for. Another idea is that you can reach out to an agent. There are a number of agents that deal with plans sold through the exchange. It doesn't cost you any more money than doing it on your own. You're going to get the same price whether you do it on your own or you do it through a broker, because the plans are set up to pay a broker without any additional cost. The benefit of dealing with a broker is that you have someone helping you do this, make sure that you fill things out properly, and also could be a resource to you if things don't go right. So it's really up to you and how you want to proceed. But you definitely, if you are eligible for subsidy or want to qualify for subsidy, there's a way that you can do it. And keep in mind, it is income-based. It is currently not asset-based. So you could have done a good job saving money in retirement and still be able to qualify for a subsidy. You just need to structure your income to make sure that you stay underneath your modified adjusted gross income limit based on your household size, whether you're a single person, a married person, or maybe even you still have dependents going into retirement. You want to understand what those limits are. One final tip on this is that, let's say most of your money is all in retirement accounts, all pre-tax money, meaning when you take it out, you're going to pay, it's all going to be taxable to you. So this would all be considered towards your modified adjusted gross income. And you need to take out more than, let's say, your maximum income allowance for the subsidy of $70,000 a year. You could maybe take out money in advance of the year you're going to retire and set it aside or start to build up your cash reserves so that that could help offset any additional income you needed and not then have you lose your subsidy. Another idea is that you also could set up a home equity line of credit before you retire, and you could borrow against that home equity line of credit. And then, when you are eligible for Medicare, you no longer have to worry about your income limit. You could then take more money out of your retirement accounts and pay off that home equity line of credit. So I hope you found this episode informative on how you could qualify for healthcare subsidy in retirement. And if you have a listener question that you'd like to have considered for a future episode, you can submit that listener question by going to retirewithryan.com, clicking on the contact button, and submitting your listener question. Have a great week, and I look forward to talking to you next Wednesday. Take care.
You should consult a financial advisor familiar with your specific circumstances before you make any financial decisions. Nothing in this broadcast constitutes a solicitation for the sale or purchase of any securities. Any mention of rates of return are historical or hypothetical in nature and are not a guarantee of future returns. Ryan Morrissey, CFP, is an investment advisor representative of Morrissey Wealth Management, LLC, a registered investment advisor.